What we're doing now is preparing to do what's called a hysteroscopy, in which we take this sort of long camera tube and try to slide it up into the uterus to get visualization inside. Because we know she has a polyp, and we're just going to wait a little bit for a second. And then we have to sort of open the pathway. The fancy word for that is to dilate. So we can slide this scope up there. Then you'll be able to see the inside of the uterus and the polyp, hopefully, as well as the openings to the tubes on both sides. Once we're ready to get going, which takes a few minutes, not long. And we'll get started. It's a hysteroscope. This is the part that goes inside the uterus. There's a light at the end and a camera to take pictures. And then a little instrument can go through here that will come out at the other end to take out the polyp. This allows for water to go inside the uterus, and this allows for suction on the yellow. So the water is there because the uterus needs to be distended. So you'll see the inside of the uterus now. And it's like polyp. I'll show you in a second. Just going to focus it. But we're inside the uterus. And you can see there's this polyp right there. Let's turn off the vacuum so it's clearer. Right there. And in a second, you can see the opening to one of the tubes, hopefully. The bubble there tells me I didn't perforate the uterus, right? There's some more polyps down there. And off to her right side. So look at the opening on that side if we can get to it. Right up there. See it? Little hole up there? Can you take a picture for me, please?
Yeah.
Okay. And if we take a look back, you can see the top has all of these sort of fluffiness. And these sort of polyp-like structures that stick into the cavity. Right? And here's a big polyp down below. Here's the biggest one. See it? And now I'm going to ask for something called the Myosure light, please. This is what it looks like. You can see there's like a little window at the bottom there, a teeny tip. So that's going to go inside the uterus. And now you'll see this polyp be removed very quickly. See how it's underneath there? You ready? It's pretty much gone. See that? The big part of it is gone, and it's going to clean up around it. But the polyp itself is mostly gone. It's really pretty amazing. If you watch the thing here, it's just going back and forth. It's like a blade. And then there's suction that's pulling it towards to collect it, and we can send the tissue off to the pathologist. Now I can tell you just from looking at it, it looks very, very benign. But just to be on the safe side, we always send it off. And take a picture, and we're done. And we're going to keep track of the amount of fluid that went in and the amount of fluid that came out, so that we don't put too much fluid inside the body. And in this case, it's very little that went in, so she's fine. But it's something that we always check. And I think that's it. So just let us know if there's other procedures or things you'd like to see. We'd be happy to teach you.